Two most common mistakes when working with a cannula. One is being in the wrong anatomical space and injecting the filler there. Two, creating a lot of trauma because you're in the wrong anatomical space, you're meeting resistance, and you keep trying to dig in with the cannula. So basically, let's address one most important thing, how to be in the right anatomical space when working with a cannula. There's only two spaces that you need to be in, either deep or superficial. Deep fat pad here on the cheeks and on the jawline. And how do you know in the deep space? If you lift in the cannula and it lifts like a mountain, like this, like a lag under the blanket, you in the deep fat. If you lift the cannula and it lifts like a cannula, you see the outline of the cannula like a lag under the sheet, you are in a superficial fat pads, which you will be injecting filler here, here. So cannula is a blunt device. So yes, of course, you're going to meet some resistance when you first introduce in the cannula. However, after that, if you're in the right space, you will feel very smooth, kind of light pressure, but not a lot of resistance. If you're meeting resistance, that means you are not in the right location. What you need to do is come out, redirect, and try to go in again. If you're meeting resistance, no matter what you try to do another port. Do not try to do the technique what a lot of injectors do, is do this and just kind of like corkscrew, try to break through it. This is not the right technique, and that's how you get in trouble, to creating a lot of trauma, bruising, and this is kind of defeating the whole purpose of using the cannula. One little trick, if you know you're in the right space and you're meeting just a little bit, maybe fibrosis, if the patient had prior sculpture within 6 months, or if they had a facelift, and you know you're not digging into something in the wrong space, then you can extrude a little bit of filler, or sculpture, depends what you're working with, just a little bit, just a tiny bit, and then you'll feel the cannula will pass that area really smoothly. If you extrude a little bit of product and still meet a resistance, you're gonna come out and try again in another space.